All right, everyone. I think we're going to get things rolling here. I welcome you all to our Learning Cafe today entitled, What is Applied Behavior Analysis? Exploring the theory and practical applications of ABA with children. I'm very happy and honored to have Dr. Emily Corwin with us. But before we get started, just a few things of housekeeping. First off, I do have you all on mute. If you have any questions, please feel free to put them into the chat box, and I will moderate them to Dr. Corwin as the opportunity arises. Also, at the end of the presentation today, we'll be emailing you a survey link. The email will be from the COE. And we ask that you please complete that survey. And if it's emailed to you, you'll also automatically receive a certificate. That survey really helps us to figure out what went well, what didn't go well, and how the kind of virtual training was for you. You may also need to check your spam folder for that email. If you did not register, you do not receive an email. There is also going to be a link in the chat box here towards the end to also click on the survey. If you click on the link through the chat box here, you'll have to enter your email at the end of the survey to automatically receive a certificate. And also, if you're with the Department of Children's Services, please email Karen Gray to make sure that you get credit for your time with us today. Without further ado, I'm going to please introduce Dr. Emily Corwin. Dr. Corwin is a DCBA and is a licensed psychologist who received her doctoral degree in psychology from Louisiana State University, where she focused on school psychology. Dr. Corwin completed her internship and postdoctoral training at the Kennedy Krieger Institute at Johns Hopkins University School of Medicine. Dr. Corwin worked as a behavioral health consultant at Cherokee Health System until very recently. She is currently a pediatric psychologist at East Tennessee Children's Hospital. Dr. Warren has extensive training in consultation, parent training, PCIT, my favorite, trauma-focused cognitive behavior therapy, and applied behavior analysis. Without further ado, I'm very pleased and honored to present to you Dr. Emily Corwin.
I'm happy to be here. Okay, I guess I'm going to share my screen. Should I do that, Drew? That makes sense? Let's see. Let me make this slideshow. Let's see. Okay, well, hold on a second. Should have practiced this, guys. I apologize. So I should share my screen. Okay, did that work? Okay, all right. So today we are going to be talking about what is applied behavior analysis or ABA. And we're going to talk some about the theory and applications for kids. If we were physically together, I would have everyone say how many people have taken a class on ABA and how many people have practiced ABA, because I think ABA is not super user-friendly in a lot of ways. The jargon is tricky, and there's a lot of it. And I will just say I took many classes on ABA before I practiced it, and I really think that I did not understand it very well until I practiced it. So I'm going to try to make this as real life as possible, so by giving lots of examples, because ABA, I think the tenets and the foundations of ABA and the practical side of it is incredibly useful for any human being, especially those who are providing treatment and therapy to kids, but that it can be, it's just not very user-friendly. So we're going to try to break it down and make it as user-friendly as possible. Okay, so we will be talking about kind of the history of ABA, where it came from, the core tenets. We'll be talking about 5 kind of core basic principles of ABA. We'll go over a list of therapies and strategies that pull from ABA therapy, ABA theory. And I do want to give you guys a list of where to access these services in our community. And it's not an exhaustive list, but it's the organizations I'm aware of. So that's kind of the plan for the next hour. And I think Drew and I talked about this before we got on today. If anybody does have a question, oh, and he mentioned this too, but if anyone does have a question, type it in the where you can type comments, and Drew will interrupt me. I'm happy to be interrupted with questions. Whether or not I can answer them, we'll see, but I'm happy to be interrupted with questions. Okay, so what is applied behavior analysis? First and foremost, applied behavior analysis is a science that's intended to understand and improve human behavior. The field of ABA really grew out of behaviorism, which was kind of a rebellion against early psychology's focus on internal thoughts and internal feelings. Early behaviorists really believed that we needed to kind of ignore all the going on the inside and focus on behaviors that we can really see and quantify. So that's where ABA came from, is from behaviorism, but the focus of behaviorism was really on understanding behavior. So less using the principles and more just understanding what are the principles, what impacts behavior. Early behaviorism kind of focused on research with rats and pigeons, and the primary dependent variable was lever presses, which is not valuable to human beings, right? We don't care that much about lever presses, but that's where it all came from. Around 1968, that's where most people agree that ABA kind of began. Was when the Journal of Applied Behavior Analysis began putting out issues. And in the very first issue, Bear, Wolf, and Risley published the the article with some current dimensions of applied behavior analysis. So it was an article that really defined the field, and that that's required reading for every intro to ABA class that I know of. The focus changed from understanding behavior to changing behavior. So we really wanted to use what behaviorism had learned and apply it to behavior in a way that created some socially meaningful behavior change. So that's kind of where ABA came from. There are lots of common misconceptions around ABA, and I want to address some of them. I'm sure this is not a complete list, but I do want to talk through these because I think they're the ones that come up the most often. So the first is this idea of ABA as a treatment or a therapy. Most of the time when folks say that kid needs ABA therapy, what they really mean, and what I really mean, because I say that a lot, what I really mean is they need a therapy informed by ABA. Because as we said before, ABA really is a science. It's really not intended to be a therapy. There are lots and lots and lots of ABA-informed therapies, though. Kind of to go along with this ABA as a treatment or therapy, there's a misconception that discrete trial training or discrete trials therapy is ABA. And I do think that's one of the most used therapies. Uh-oh. Can you guys still hear me? Drew, I'm asking because it said I've been signed out.
Nope, you're still
fine.
Are we good?
Okay, just wanted to make sure. I just got a little pop-up that said that my account had been signed out, so I wanted to double check. Sorry about that. Okay. Okay, so discrete trials training or discrete trial therapy is synonymous, and it's not. It's one of the most used ABA-informed therapies, I think, but it is not all that ABA is. And discrete trials also was not invented by ABA. Discrete trial training has been around forever. All it is, and I think there's some mystery around discrete trial training too, all discrete trial training is there's usually two people, usually a teacher and a learner, together in a room, often at a table. The teacher gives a prompt, what is this? The learner responds, and then feedback is provided. That's it. That's a discrete trial of learning. And that's been around for always. So it was not invented by ABA. It is utilized often when we're talking about ABA type therapies. For ABA and problem behaviors, So I do think there's this idea that ABA is really intended to work on only problem behaviors, severe behaviors, challenging behaviors. And that's just not the case. It helps a lot with those behaviors, but in my opinion, ABA really is at its best when we're working on behaviors, good positive behaviors, adaptive behaviors that either we have seen in the child or the person that we want to see more of, or that we're trying to develop kind of from the beginning. So we're working on those positive behaviors or adaptive behaviors and using reinforcement and environmental modifications to kind of build those. So not only intended for challenging or severe behavior, you can work on your most mundane behavior. I think there's also this idea that ABA is only good for people who have developmental delays or have an autism diagnosis. That's also not the case. We're going to talk about some examples later on, but ABA is useful for spouses. ABA is useful in like college classrooms, in classrooms from K through 12, gen ed classrooms. ABA is useful and can be utilized for any human or kind of higher, like I'm going to give an example about my cat later. So it can even be used on cats and other types of animals. So ABA can be useful for any person, and I would say most animals too. I also think well-deserved. ABA has a reputation for being damaging. And so the field has come a long way in the decades that it's been around. But early on, we have a questionable, concerning history of use of punishment. I've seen some videos that I think have made me cry about use of punishment on kids. And we're not that anymore. Okay, so yes, I think that well-deserved, there's this idea that ABA can be harmful, but that we've come a very, very long way since that time. Our code of ethics is really clear on the use of punishment. And any good behavior analyst or behavior technician is going to start with reinforcement and kind of the positive side of ABA. They're going to start with that, and they're going to start with environmental changes. So how can we just change the way this kiddo's environment looks to help support the behavior that we want to see more of? Punishment is a part of ABA plans often, but it's not what it was. We care very, very, very much about keeping kiddos safe at this point. So those are some misconceptions that I hope that we have touched on and maybe cleared up a little bit. Let's see, check the time. All right, so the ABA and ABA therapists are going to focus significantly and kind of solely on objectively defined behavior. So when you're working with an ABA therapist, you're going to hear things like an operational definition for a behavior. So we are going to say what this behavior is and what this behavior is not. And you're going to see tallies and you're going to see timers, okay? Because we really, really want to capture definable behavior. We're going to do frequency counts or duration, if that makes more sense. We might do a latency count. I'll give some examples of those in a minute. And the goal of this is to use numbers. So we want to put a number on a behavior, and we want to show, by putting it on a graph, show the relationship between whatever we've changed in the environment and this child's behavior. And usually just one clear, well-defined behavior is what we're looking at a time. So for frequency, we might be counting the number of self-injurious behaviors we see in a period of time. We might count the number of times a student talks out in class. For duration, we might time the length of a scream or the amount of time a student is able to remain on task. For latency, so some examples would be the length of time between going to bed and going to sleep. How long does that take? Or the length of time from a bell ringing at school to the child's bottom being in his seat at the start of the next class, or the length of time from a direction being given to subsequent compliance. So we really want to put numbers to behaviors to help really clearly capture and understand what's going on with a kiddo's behavior. Drew, do we have any questions or anything?
Not at this time.
Okay, cool, just checking. All right. So we mentioned earlier that the focus changed when we started getting from behaviorism to applied behavior analysis, the focus shift to socially meaningful behavior. Within an ABA program, we have kind of a hierarchy. So we're going to prioritize some socially meaningful behaviors over others. We typically will start with communication because that is a skill that's going to help the child gain the most control over his environment, his or her environment. So usually, if we can, we're going to start with verbal behavior, increasing spoken communication. If that is not possible, then we might use like a picture system or some type of communication board. So something that the child can go from maladaptive and difficult behaviors to giving them a way to ask for the things that they want. And so we're going to focus on communication first. Then kind of below communication is that we'll talk about social skills and work on social skills. And this can go from like explicitly teaching eye contact to explicitly teaching what it means to have a conversation and practicing that. It might be hand raising in the classroom. It might truly be asking, teaching a child how to ask about somebody else's interests. So the reason why we then focus on social skills is because this makes the child more endearing to those taking care of him or her and to those in their environment, which typically then results in just better functioning within that environment and more control over their own world, which is I think a major goal that we have. After social skills, we're going to work on independent skills. So this would be things like tying shoes, brushing teeth, making a peanut butter and jelly sandwich. So things that, again, give the child more control over their own environment and their own world. So this is what we mean when we say we're focusing on socially important or socially meaningful behaviors. Okay. So that was kind of the history, a little bit of the history. Let's kind of transition into basic principles of applied behavior analysis. There are a couple other basic principles other than these 5 listed here, but these are the ones that we're going to really focus on today. I think that they have the most bang for their buck. I think they're the most usable and the most easy, the kind of the easiest to think about. So we have reinforcement, motivation, extinction, punishment, and stimulus control. Those are the things we're going to talk about today. We will be delving into reinforcement, motivation, and punishment like in the next few slides. So I'm going to take just a minute and give some examples on extinction and stimulus control because we're not going to spend any more time on those. But first, so the basic principles, these were discovered during the behaviorism phase of things. So in the 1920s and 30s, B.F. Skinner wrote a book called The Behavior of Organisms, which it's hilarious to me. The behavior of organisms was based on various research projects or studies on 16 rats. And he said at the end of the book, let he who will extrapolate do so. So he so fully believed that these principles of behavior were universal that he said, yeah, so I just did some studies on 16 rats. Let's go apply them to humans. Which that's what applied behavior analysis did, but it's very bold. I also want to just mention early on behaviorists and even sometimes applied behavior analysts and technicians discounted anything going on inside. Anything internal, thoughts, feelings, whether or not a child had a soul, right? So all of these things that matter, especially to parents in the picture, didn't matter as much to the behaviorist. I think this has changed. I don't know if that's a universal statement. The ABA therapists that I know believe that kids have thoughts and feelings that matter. But at the same time, we can manage behavior using these principles, kind of regardless of whether or not they have thoughts or feelings that matter. But I think a good behavior analyst is going to acknowledge those thoughts and feelings, because how else are we going to get anywhere with parents, right? If we don't say, like, of course this is hard for you, and of course this is hard for your kiddo. I know it's not easy to hear your baby cry. Let's talk through why this might actually be helpful for him in the long run, right? So acknowledging those thoughts and feelings. All right, so extinction and stimulus control. Extinction is when we remove reinforcement from a behavior, typically to see that behavior decrease. And oftentimes when we're talking about extinction and reinforcement, we're talking about accidental reinforcement. So what has happened is a behavior, somebody in this child's environment has been intending to punish a behavior, to try to make that behavior go away. And for whatever reason, the consequence that was chosen ended up reinforcing that behavior. So the behavior ended up increasing over time rather than decreasing. So extinction is the practice of pulling away that reinforcement to then see behavior decline. I'm going to give an example with my child. So here in the last few weeks, my daughter, who's 3, has been getting out of bed after being put to bed 6 to 10 times before going to sleep. And we have a behavior system in place that's really pretty pathetic. I mean, I'm going to just be honest. It's not all that helpful. It has some behavioral principles kind of peppered into it, but it is not working. It's not working. And the reason I think for that is, so when we're thinking about her motivation, why is she getting out of bed? She wants attention from me and her dad, and she wants to escape the expectation that she go to bed. She has the most FOMO of any child I've ever met, and she doesn't want to miss anything. So we're working on attention and extinction. Attention, and escape. And every time my husband and I go up to her room and say, you're safe, you're fine, we love you, everything's good, it's time for you to go to sleep, please go to bed, she is getting attention and escape, right? So she's getting our love and affection, and she is delaying going to bed, right? So our system is not working. If we were to put an extinction protocol into place, we would put her in her bed, shut her door, and not go back up to her. Okay? And I fully would expect that she would cry and scream and have a big old tantrum, and it would be heartbreaking. And so lots of times when we are working on extinction, we're also trying to pair it with some type of a reinforcement, something to make it a little bit more positive for the child, because you do often see an increase in behavior when you put an extinction protocol into place. All right, so that's extinction. Stimulus control is simply that we can tell the difference in our environments. Okay, so we can tell that over time, after we've learned, we can tell that reinforcement might be available in one environment, whereas that same reinforcement is not available in another environment. I'm going to give another example with my daughter. I think it's just easy to picture. So with my daughter, she knows without a doubt, she's tested a couple of times, but we've never given in. She knows that she is never going to sleep in bed with me, and I'm never going to sleep in bed with her. Okay, she's going to sleep on her own. And so she never asks for that to happen, for either her to get in my bed or me to get in her bed. And so if you were to observe her only in that environment where me and her dad are in control of her environment, you would think that wasn't a behavior in her repertoire, right? However, if you introduce grandmother into the equation, Eliza has learned that grandma's going to lay down with her, or let Eliza lay down in her bed, in grandma's bed. So immediately, the minute she decides, I don't want to go to bed, or I don't want to go to bed alone, she's going to ask. So if you were to observe her in an environment where grandma is in charge, you would think she probably does that everywhere. She probably always wants to sleep with somebody. She probably never can sleep on her own, right? But it's the environment that's different. and her behavior is dramatically different in one environment versus the other. So things can have stimulus control, environments can have stimulus control over a behavior. I have one more example, and I just think this one's fun, so I'm going to share it. It's about my cat. I think I have time. And this would have worked. This would have worked if I had a husband and a roommate who did not laugh at me when I suggested it. So we lived in Baltimore for a couple of years. We lived in a row home, and we had a little back patio, and our cat loved to go on that back patio, loved it. And anytime we were anywhere on the first floor of that row home, she would be meowing her head off to try to go outside, to let us know, hey, I'm here, I want to go outside, meowing like crazy, and drove us nuts. And I designed an intervention that never was implemented because I was laughed at, where I was going to put a picture of a big X on the door. And that big X was going to signify, you're not going outside, cat, stop asking, okay? But at the times when either we were about to go outside or we were able to watch closely enough so that she could go outside by herself, we were going to take that X off, okay? And she would learn, I know she would have learned over time, when the X is there, might as well not meow. When the X is gone, I can meow and ask to go outside. And I know that would have worked, but that's another example of stimulus control. Or would be another example of stimulus control if we had ever gotten to really do it. Another area where stimulus control is often used as an intervention is with feeding and eating. So lots of times when kids or families or whoever has a problem kind of grazing throughout the day or all over the house or whatever, setting a rule and having a family agree to set the rule that we only eat at the kitchen table. And if you're not at the kitchen table, you don't get to eat. Sometimes we'll cut down on grazing throughout the day. So that's an area where stimulus control is often used as an intervention. Okay, so those are the basic principles. Let's talk, I want to just briefly mention the ABCs, because if you're working with any behavior therapist, you're going to hear about ABCs, and it's important that you are familiar with those. So when we talk about the ABCs of ABA, we're talking about antecedents, behaviors, and consequences. Because when we are focused on a behavior, those in the environment, so either the parent or the teacher or whoever is managing the behavior, really has no control over the behavior itself. We can't just like hold a kid to stop him from tapping on his desk or whatever it is. It's not effective, it's not efficient, we're not going to do that. It's not healthy. But where we do have control is how the environment is set up. So those antecedents, what happens before, what reliably happens before this behavior. And we have some control there. And then what happens right after the behavior? What's the consequence? And we have some control there. So when we are talking about managing or changing behavior, we're really going to work in antecedents and consequences rather than on the behavior itself. Okay, so some examples. So an antecedent is a stimulus or environmental event is presented. So it could be an instruction is delivered. A behavior might be, and this is clear, right? We could count it. A child complies within 5 seconds. And then a really good consequence for that would be a labeled praise for listening. Thank you so much for listening right away. Okay, so that's like a behavior chain. Another example, let's say in classroom, a teacher assigns some classwork. That's the antecedent, that's what happens before. The behavior might be that a child is off task or engaging in disruptive behavior. And that would obviously need to be more well-defined than what I just did so that we could count it. And then a consequence might be that a warning is given by the teacher. So for example, Johnny, if you keep tapping that pencil on your desk, you're gonna lose computer time later today, okay? And that may or may not be effective. We would have to look at the behavior over time to know. All right, so that's ABCs of behavior. Now we're going to get into motivation. So this is one of those 5 kind of core basic principles of motivation or the function of behavior. So one of the major things that we can do when we're either working with an ABA therapist or engaging with another human, period, is figure out why they're doing what they're doing. And we know that there are really 4 main reasons why a child might do or person might do the things that they do. 3 of the 4 we can have control over, or some type of control over, okay? And we'll talk about the 4th one also, just briefly. So with functions of behavior, attention is definitely one of the functions. And that is simply anything that is delivered by another person socially, following a behavior. And it does not have to be positive attention to be reinforcing, okay? So this is something to really, really keep in mind. Attention can be praise. Attention can be maybe a kiddo, gosh, my kid yesterday said, when I say toot, my friends laugh, right? So she's 3, she's doing that potty language, and she's figured out that her behavior, saying toot, results in the social attention of laughter from her friends. Some other attention, so we have some good consequences, but we also have yelling, which is attention, spanking, which is attention, even just like, what is it, right? Like, that's not positive. We would never believe that a child like wants that reaction, but it's very possible that when kids are getting that reaction, the intensity of it matters more than whether it's positive or negative, right? So once they kind of get their parent riled up, they're getting a really intense dose of attention, and so that might be really motivating their behavior, even if the parent is intending for their attention in that situation to be a punisher. Okay, so that's attention. We also have the tangible function. So this is trying to get access to something physical. These days, a lot of times it's cell phone use or like TV time. But classic kid in the candy store example, right? So kids in a candy store want some chocolate kisses. Mom says no, kid throws a fit, okay? The function of that behavior is, I want the chocolate kisses and you have said no. Okay, so it's that tangible reinforcement. And then escape is kind of what we talked about earlier with my kiddo. She hates going to bed and wants to escape that environment. But it also could be like if a child feels inefficient at math and so acts out during math class and gets sent to the principal's office every time. If that behavior doesn't decrease over time, then we can assume that kid wants to get out of math class, right? And that going to the principal's office isn't an effective punisher. In fact, it's a reinforcer. So those are the 3 main functions that we have control over, right? We have control over when we give our attention. We have control over when we let people that we are managing, when they can get items in their environment. And it may be a little harder, especially as kids get older, but we can control when a kiddo escapes from a task, okay? So that's why those are kind of bigger and more focused on. Automatic reinforcement is another function of behavior, but it's referring to something that's going on internally. So lots of times we see that like self-injurious behavior is automatically reinforced, and that just means that something about hitting their head or whatever self-injury is happening is soothing or is relieving some type of a pain in their body, something. It's going on internally, which we don't have control over, right? Another example of automatic reinforcement is like taking Tylenol, okay? So if I have a headache and I take Tylenol, I'm not taking Tylenol for attention or to get access to something in my environment or to escape from something. I'm taking Tylenol because my head hurts and taking Tylenol makes it feel better. Okay, so that's internal. So it's that automatic reinforcement. Okay. All right, we're gonna talk through reinforcement and punishment because these can be tricky. And what I want to say, I think before we get into this, is that what makes a consequence a reinforcer or a punisher is not the intent of the person using reinforcement and punishment, okay? That doesn't, what we intend to happen doesn't matter. What matters is the effect it has on behavior, okay? So if a behavior increases over time or maintains over time, then we're using a reinforcer, whether we want to or not. If a behavior decreases over time, then we're using a punisher. That behavior is going away because we're punishing it over time. And this can get really confusing and tricky. I will talk through a couple of examples, but let me talk through positive and negative reinforcement and punishment first. So positive and negative, this is one of those areas where ABA speak is different from, you know, layman's terms. So we don't mean good and bad when we say positive and negative. When we say positive, we mean something is added to the environment. And when we say negative, we mean something is removed from the environment, okay? So positive reinforcement simply means we are adding a pleasant stimulus and with the goal of increasing or maintaining behavior. So for example, a kid gets a sticker on a chart when he follows an instruction, okay? That is positive reinforcement, assuming the sticker is reinforcing, right? For negative reinforcement, we are taking away an unpleasant stimulus to increase or maintain behavior, all right? So an example here would be, let's say I live in an apartment, person above me is playing really loud music late at night and I'm trying to sleep. And so I go get a broom and bang it on the ceiling, and the music is either turned off or turned down, which is exactly what I want to happen, right? That aversive, loud music is removed from my environment, which makes me more likely to grab a broom and bang it on the ceiling the next time something similar happens, all right? So that behavior of banging a broom on the ceiling is reinforced, all right, because of the removal of the loud music. Lots of times parent behavior is maintained by negative reinforcement, okay? And what I mean is kid behavior can be frustrating and annoying, right? So if we've got a kiddo who's having a tantrum and we know that giving into their tantrum will take the tantrum away, will stop the tantrum. If we do that and see that that's what happens, we're more likely to give in the future, okay? And that's what happens every time. When you give in to a kid's tantrum, the tantrum stops. So it's very helpful to understand parent behavior and to like not blame parents because their behavior is being reinforced by their kid's behavior and the removal of that tantrum. So it's a very natural law of behavior. Positive punishment is when we intend to add an aversive or an unpleasant stimulus with the goal of decreasing behavior. So this would be if I'm feeling angry, my kid's yelling, I'm feeling angry, and I raise my voice at her. My goal is punishment. It might not end up being punishment, right? She might really love that big old dose of attention she gets. But my goal is punishment. I'm adding yelling to the environment with the goal of decreasing her behavior. And then negative punishment is when we remove something pleasant to decrease behavior. So let's say a kiddo comes in late for curfew, misses curfew, and so parents remove access to the car for the next week. It's negative punishment, okay? I want to talk just briefly about accidental reinforcement and punishment, just to talk about how much motivation matters, okay? So we've talked through this a couple of times, but I just want to highlight it. If we've got a behavior that we want to reduce and the parental consequence is yelling, but we see the behavior increase over time, then we're dealing with reinforcement and we need to convince that parent to try something different than yelling because they're reinforcing the behavior, whether that's their intention or not. Similarly, especially with kids with autism or other developmental delays, or maybe kids who are shy, they may find social attention to be punishing, right? So if a kid finishes a math problem and we say, whoa, yay, good job, that's awesome. Thanks so much for working on that. I make a big deal about it. If that social attention is unpleasant to that child, they're gonna say, oh, I'm never finishing another math problem again. I did not like that, okay? So our intent doesn't matter, it's the effect on behavior that matters. And so we have to understand motivation for the kiddos that we're working with. Okay. All right, why ABA for ASD? So I started out this presentation by saying, yeah, this is for everybody. We can use this on spouses and typically developing kids, but it is, I cannot undermine or discount the fact that ABA supported therapies are incredibly good for kids with autism. They're very helpful. And the reason why is because developmental delays, by definition, mean that a kid's behind, right? They're behind their same age peers in some category. And so we, as the people intervening in these kids' lives, we have to be able to teach more in less time, or the child is going to just fall further and further behind, okay? And what we've seen and what we've talked about throughout this presentation is that ABA strategies usually or often focus on really concentrated learning, right? So we are repeating trials over and over and over and over again to help them practice as much as they need to catch up to their peers, because their peers are more likely to be motivated by naturally occurring contingencies. Okay, so what that means is that a kiddo who's typically developing may notice and care about the social attention that they get when they raise their hand in class, whereas a kiddo with autism may not notice or care about that attention, right? And so the naturally occurring contingencies, the natural environment that's providing reinforcement is not motivating to that kiddo. So we have to find what motivates these kids and what they're gonna work for, and then let them practice, 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 practice. So that's kind of the biggest reason I think why ABA is so good for kids with autism, because, and it is. I don't wanna undercut that. Okay, all right, so we've talked through a couple of these already. These ABA supported therapies, right? We said ABA is a science, not a therapy, but ABA supported therapies. We talked about discrete trial training. Some others that you'll hear about a lot if you're working with ABA therapists is functional communication training. So this is finding other ways to help a child communicate with his or her environment. A type of functional communication training is PECS, or the Picture Exchange Communication System. And there's kind of a picture of that on your screen, or on the screen, I should say, where the child can say, I want, or I need, and point to a picture. And that's PECS, which helps them have more control over their environment. Social skills training often comes up within the world of ABA. And like I said earlier, this is often explicitly teaching things like having a conversation, asking about the interests of others, how to make eye contact, smiling, things that come naturally to kids without autism often, but need to be taught more explicitly to kids with autism. I'll also say kids with ADHD. I feel like kids with ADHD sometimes fall into needing this type of therapy because they may notice and care. Well, they may care about the contingencies in their environment, but they may have a hard time noticing the contingencies, right? So they may need more of this explicit teaching also. You may hear about pivotal response training when you're talking about ABA therapies. And this is just based on the idea that there are some behaviors and some skills that open up the door for like hundreds or thousands of other benefits to the child. Reading is often given as an example. So if we're able to teach a kid how to read, think about what opportunity that opens up for them. And while I was thinking about this presentation, I also have a 5-month-old at home. Well, not at home, at daycare right now. But I have a 5-month-old, and I was thinking about his early development, and that social smile that comes at about 1 to 2 months is game-changing for both the kid and the parent, right? Like it starts to feel like it's worth it when you see that social smile. And they now, the baby, 1 2-month-old baby now has a way to communicate with his environment that's not crying, right? So that's another kind of, I don't know if it's involved in any type of therapy, but it's one of those it's an example of, I think, a pivotal response, a pivotal behavior. And then, of course, we're going to see lots of reinforcement-based strategies at work when we're talking about ABA therapy or ABA-supported therapies. So you might hear about functional assessments. So this is where we put the kid in different situations to see what their behavior looks like, given the consequence, to try to see whether we're dealing with attention-maintained behavior or escape-maintained behavior or tangibly maintained behavior. And I want to be clear, especially with typically developing kids, it is often multiple functions, right? So I said earlier with my kiddo getting out of bed, it's not just attention, it's not just escape, it is both, all right? So lots of times you're dealing with more than one function. You might hear about a reinforcer assessment, and this is where we are trying to identify something that the kid wants, something that the kid will work for, something that matters to that child. And there's several different ways to do a reinforcer assessment. But I encourage you in your own work with kids to think about, like, not just go with a sticker just because it's easy, or not just go with M&Ms because it's easy, but really try to understand what makes this kid tick, what behaviors or what environmental events are going to matter to this kid, and be really creative, because I think that they're way more than I think I typically use in a day. And then certainly finding like a schedule or a type of reinforcement system. That is a big part of every ABA therapy that I'm aware of, is how are we going to reinforce them? When are we going to reinforce them? What behaviors are in reinforcement? So using reinforcement as a tool rather than just as a principle of behavior. There are lots of therapies. This is not an exhaustive list, I'm sure. These are just kind of off the top of my head. There are lots of therapies that are informed by ABA. So the previous slide was really, these are what we mean when we talk about ABA therapy, right? This, though, I wanted you to see that behaviorism and applied behavior analysis has made its way throughout psychology. Dialectical behavior therapy is really informed by ABA. I mean, if you think about a behavior chain analysis, that's the ABCs, right? It might be a little bit more complicated and nuanced, but we're talking about antecedents and behaviors and consequences. So DBT is very informed by ABA. Parent-child interaction therapy, when we're talking about the labeled praise, like all of those good pride skills, we're assuming a function of attention when we're talking about those reinforcers, but we're talking about reinforcers, right? The goal of reinforcement. Same thing for the timeout component. I've always had a little bit of beef with PCIT, sorry Drew, because timeout is utilized regardless of the function of behavior. And this would really irk me if the child weren't ultimately required to comply, right? That I would say, like, no, this is, don't buy it. But because PCIT within the protocol requires the child to comply ultimately, the child is not totally escaping from an instruction. They may be delaying it by going to timeout, which might be reinforcing for the child. And I think we need to be aware of that. But the child's not ultimately escaping, so not getting out of it. So I buy it. Behavioral parent training is clearly very informed by ABA. Any cognitive behavior therapy, right? So we're talking about TFCPT, the Coping Cat program, all of these have components of ABA within them. And then exposure and response prevention came to mind also, very informed by ABA. Okay, and then ABA strategies. So I hope we've talked about this kind of throughout, like ways to use these principles that we've been talking about. But these are just some examples. So labeled praise or another reinforcer, when you see appropriate behavior, anybody can do that. Primary care provider could do that, therapist could do that, OT, PT, teacher, parent, anybody can do that. And it's an ABA strategy, right? Planned ignoring of inappropriate or unwanted behavior. is an ABA strategy that can be really well employed to kind of reduce some disruptive behaviors, especially if the function of the behavior is attention. Effective instruction delivery. This is an antecedent strategy, so we're changing the way we give instruction. So really, what I love about this is that the adult in this situation is owning a part of the problem, right? So we're not just saying like, oh, this kid's behavior needs to change. We're saying, what can we do differently to help support this kid to follow instructions a little bit better? And so there are several different components of effective instruction delivery. That can really help, and it's a behavioral strategy. You might see or hear or use guided compliance or the 3-step prompt. So this is giving an instruction and then forcing compliance after a couple of opportunities for the kid to do it himself. I say forcing, that sounds mean, but it's just guiding, physically guiding completion of the request. When I was thinking about this, the good behavior game came to mind. I don't know if you've ever heard of this. It's a classroom intervention that has been described as behavioral penicillin in the literature. It is so effective within classrooms. Teams, the class is divided into teams, and each time a defined disruptive behavior occurs, that team gets a point, positive punishment. And the team with the fewest points at the end of the day gets some type of a reward. And it can really just change the dynamics of the classroom, and it's behavioral. And then check in, check out for school settings, or like a daily behavior report card, those types of things. So we're clearly defining behaviors. We're giving feedback on those behaviors throughout the day. And if the kid meets a goal, predefined, defined at the beginning of the day goal, then they're going to get some reward at the end of the day. So those are some strategies, and there's more, but those are probably the biggest and most accessible ABA strategies to use in your work or in your practice. Okay, so in summary, ABA is a science that informs treatment or therapy. ABA strategies can be useful for and applicable to any human being, and I would say animal too. I mean, really and truly, like, when you're training a dog, those are all, it's all ABA. Training a cat too, it's all behavioral. And ABA therapy does not mean any one specific therapy. It can mean a vast array of different types of therapies or strategies. So those takeaway points. And then these are some organizations within our community, within the East Tennessee and Knoxville area that provide ABA services. So I wanted you guys to have that.
Dr. Corwin, we have a question.
Sure.
What are the best strategies, type of ABA-informed therapy for kids who are middle school or high school aged?
Oh gosh, the best strategies. I mean, getting a social contingency set up, I think would be really helpful with that age group, because they care about what their peers think, right? So even maybe a type of modified good behavior game could be helpful, though that's probably more intended for elementary school ages. Some kind of, I definitely have used like a check-in, check-out type system with middle schoolers, though you got to be, careful to do it in a way that's not embarrassing to them. Are we talking about school setting? Remind me, Drew, school settings or home setting or both or any?
I'm going to mute Sarah Scott so she can talk with you about what she was thinking.
Okay.
Hey, I was just wondering, as a therapist, so I have multiple therapists under me that I work with, who we get a lot of children with autism who come in, and I guess our understanding has always been, have they done ABA therapy? But then it's like, that cuts off at like age 5. That is our misconception, as you say. And so I guess we're always wondering, like, how can we help these children? Like, what do none of us ever feel prepared enough. None of us ever feel like we have enough tools in our belt to deal or to really fully help these kiddos who are in closer to middle school or high school. And I guess where to start with that.
Yeah. And I would say to go back to the basics, right? So every kid has something that they care about. And so it's completing some type of a reinforcer assessment. What do they want? What will they work for? And getting creative with that. Pulling in parent involvement in that can be very helpful. And so doing a reinforcer assessment and figuring out what the function is, right? So if we're dealing with attention, then we need to give them attention in some other way. If they're dealing with escape, we got to give them a way to appropriately ask for and receive a break. Right, so looking at those two reinforcers and the function of the behavior. And I will just tell you that it is hard. I don't know, I wouldn't feel, and I hate to say that, but I think that would intimidate me too, because I do think teenagers are just they're a different beast. And you're right, you're absolutely right that these services are often primarily given to young children, but that doesn't mean we can't use ABA and the strategies we just talked about to help older kids also. But it's just finding the motivation and what they're going to work for and setting up a system for them. I don't think that was very helpful. I'm sorry.
It's okay. That was as helpful as anything else we've had, so I appreciate that.
Okay, good. Are there any other questions?
Yep, there's one more question from Amy Diller. I work in Middle Tennessee in Rutherford County. I have clients who have been on a waiting list for ABA therapy for over 2 years. How can I find ABA resources in my area? You
can look at the BACB registry, the Board of Applied Behavior. I would have to look it up. I don't know. It's the board that certifies me, so I should know it, but I don't. BACB registry, and see if there are any other providers. I will say that, like, I'm on that list, and I'll see kids for therapy who need some ABA type services, but I'm not doing what we think of when we say ABA therapy. And that is because historically, and I do think this is changing, so I do have some hope for this problem, but historically ABA services have been provided for like 40 hours a week. And that, I think, more and more we're starting to see that we can do more with less time, and we can serve more kids with less time. So I have hope that that is going to get better. But you're right, in Tennessee, in East Tennessee, middle, all over the state, ABA resources are very limited.
All right. Good questions. All right. Well, we're out of our time here. I don't see any other questions. So I want to thank Dr. Corwin again very, very much for giving us some of her valuable time. We really appreciate the presentation. It's very, very informative as well. Just as a wrap up and reminder, there's a survey link that is in the chat box. You might just scroll a little bit as we're all giving Dr. Emily Corwin our praise. But you should also receive an email link. Please check your spam box for that email. If you're a DCS, please email Karen Gray. Her email's in the chat box as well, so that you can get credit for today. If you'd like a copy of the slides, also email Karen Gray, and she'll be happy to get you a copy. If there's nothing else, then I want to thank everybody for attending. Our next Learning Cafe will be in August, and we will look forward to seeing everybody then.